Hello, everyone, and welcome to today's informational webinar on the new four-year Improving Equity and Access to Palliative Care Collaborative that we're launching at Healthcare Excellence Canada in partnership with the Canadian Partnership Against Cancer. We're pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your Zoom screen. If you need support at any time during the webinar, you can reach out to our tech support using the chat feature. My name is Lindsay Yarrow, and I'm pleased to be joining you as co-host for today's webinar. I would like to start by acknowledging that we're meeting on land that has been inhabited by Indigenous people since the beginning. In particular, I acknowledge that I'm hosting this webinar from Kingston, Ontario, which is the traditional and unceded territory of the Haudenosaunee and Anishinaabe people. I recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. We encourage you to introduce yourselves in the chat by sharing your name, the organization, and the location that you're joining us from today. For today's session, I am joined by my co-hosts, Tanya McDonald and Raquel Shaw-Moxham. I'm going to hand it over to you, Tanya, if you could turn on your camera and introduce yourself.
So good morning or afternoon. Thank you, Lindsay. As you mentioned, my name is Tanya McDonald and I will be one of the co-hosts for today's webinar. So nice to see everyone today. I would like to acknowledge that I am speaking today from the traditional unceded territory of the Anishinaabe Algonquin people on the territory known as Ottawa today. I recognize the Algonquin's people deep connection to the land and nature, and I also recognize that this territory is a sacred gathering place. I am privileged to be joining you from this territory today for this virtual event.
Thanks, Tanya. And Raquel, over to you.
Hi, good afternoon, everyone. I'm Raquel Shaw-Moxham, and I'm the director of the Person-Centered Perspective Program at the Canadian Partnership Against Cancer. I'm excited to be a partner within this initiative. I'm joining you today from my home within Pickering, Ontario, and I wish to acknowledge that the city of Pickering resides on land within the jurisdictions of the Williams Treaties and on the traditional territory of many nations, including the Mississaugas of Scugog Island First Nations, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And I'm privileged to be able to work, live, and share this land with my family. Thank you.
Thanks, Raquel. It's both great to have you both here on the webinar. So also joining us on the call are members of the Healthcare Excellence Canada team supporting this work. They're going to introduce themselves in the chat box, and we'll jump on screen if there's any questions answered along the way. So Healthcare Excellence Canada works with partners to spread innovation, build capability, and catalyze policy change so that everyone in Canada has safe and high quality healthcare. Through collaborations with patients, caregivers, and people working in healthcare, we look to turn proven innovations into lasting improvements in all dimensions of healthcare excellence. HEC focuses on improving care of older adults, bringing care closer to home, and supporting pandemic recovery and resilience. And with quality and safety perspectives embedded across all our efforts. We are committed to fostering inclusive, culturally safe, and equitable care through engagement with many groups, including patients, caregivers, First Nations, Inuit and Métis, health workers, and more. Launched in 2021, HEC brings together the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. And we are an independent, not-for-profit charity funded primarily through Health Canada. Raquel, I'm wondering if you can tell us a bit about the partnership.
Thank you. So the Canadian Partnership Against Cancer is also a federally funded organization. We receive our funding through Health Canada as a steward of Canada's strategy for cancer control. We are a pan-Canadian organization, and our long-term objectives is focused on reducing the incidence of people getting cancer, increasing the likelihood of people surviving cancer, and improving the quality of life of patients and providers and those that are affected by cancer. We do this work by working across the 13 healthcare jurisdictions and across the continuum of care from prevention, treatment, early diagnosis, survivorship, and palliative care. It is important to us to also monitor the impact of our work with our partners. And we do this through cancer system performance, developing indicators that drive policy and practice improvements. We also have a commitment to reconciliation and to working to foster diversity, equity, and inclusion within all of our work. So very proud to say that we are partnering within this initiative to improve access to palliative care for all of those that need this resource.
Thanks, Raquel, and thanks for everyone who's taking this moment to introduce themselves in the chat box. Really pleased to see representation from coast to coast to coast. So at HEC in the partnership, we are committed to shaping a future where everyone in Canada has safe and high quality care. We recognize this is not a reality for many, and this program aims to improve access to palliative approaches to care with and for people experiencing homelessness or vulnerable housing. We recognize how important this work, and we're grateful that you're able to join us today with the goal of improving access, experiences, and outcomes for individuals experiencing homelessness and or vulnerable housing. The objectives of today's session are shared here on the screen. We're going to be talking in more detail about the program opportunity, walking through the application process. And at the end of this session, we'll make sure there's time for questions and answers, but please feel free to use the chat box to ask any question. The team may be able to answer them as we're going through the webinar, or again, we'll bring that to the end of the webinar where we'll make sure that we leave time for that. If you have questions that arise in the days that follow or the weeks that follow, please know our team is here to help, and we'll include that email in the chat box so that you're able to reach out to us at any time. This is a new program, so if there's a question that's asked today that we don't have the answer to, we commit to working on that and sharing it out through email. So we will get you an answer to any question that's asked. Tanya, I'm going to hand it over to you next.
So thank you, Lindsay. So before we go into more detail about the opportunity to join this collaborative, we wanted to start off by grounding this presentation today in why this work is so important, as Lindsay just mentioned. So many of you are probably very aware of the inequities experienced by people who are unhoused or vulnerably housed. However, we wanted to highlight today that the average life expectancy of people experiencing homelessness is between ages 34 and 47, or 37, as on the slide, compared to the general population whose life expectancy is between 77 and 82 years of age. We also see that people experiencing homelessness are 4 times more likely to have cancer, 28 more times likely to have hepatitis C, and 5 times more likely to have heart disease. Yet people who experience homelessness have unequal access to palliative approaches to care when compared to their housed counterparts, which creates further inequities in care and health outcomes. As many of you know, there are significant structural and systemic issues that contribute to these inequities in health outcomes, including stigmatization, discrimination, or little or no access to adequate trauma-informed care within the mainstream health system, and many others. And although we are not speaking to them more in depth during this presentation today, please know that we recognize these issues and that the reasons for poor health outcomes, experiences, and limited access to services are complex. Having said that, the ultimate goal of this work is to create measurable improvement in access to palliative care for those experiencing homelessness or vulnerable housing in communities across Canada. Before we dive into the details of this particular collaborative, you may be wondering, what is a collaborative? So a collaborative, an HEC collaborative, is a model program that brings together organizations, communities to learn, apply, and share improvement methods, ideas, and data. Collaborative activities generally include webinars, workshops, coaching, and online learning tools and resources. The Improving Equity Access to Palliative Care Collaborative is a program that will bring together passionate and engaged people from organizations and communities from across Canada who are committed to increasing access to palliative approaches to care for people experiencing homelessness or vulnerable housing. Throughout this collaborative, there'll be a lot of focus on engagement, relationships, and co-designing models within communities based on needs to achieve improved access to palliative care, as well as multiple peer-to-peer learning opportunities. However, this collaborative is a little bit different from other program offerings as it will combine two types of collaboratives. The first part is a design collaborative component, and the second part is an improvement collaborative component, which I will explain in more detail in the coming slides. So what does this program look like over the next 4 years? This program will support up to 20 communities divided into 2 cohorts of 10 communities each, all focused on improving equitable access to palliative care for people who are experiencing homelessness or who are vulnerably housed. Starting in the fall, so this fall 2022, the program's first cohort will include up to 10 communities in what we are calling a design collaborative, focused on assisting teams on their implementation journey while assessing what supports will help other communities successfully implement palliative approaches to care for people experiencing homelessness or vulnerable housing. The goal of the design collaborative part of the program is to learn from each other throughout the improvement journey and to capture and translate these learnings into tools and resources that can support other communities focused on improving equitable access to palliative care, both now and in the future. During the 18-month design collaborative phase of this program, the focus will be on assisting teams on their implementation journey, all while gathering information and learning about what works and what doesn't work with respect to achieving the goals of the program, which is equitable access to palliative care. We will assess what supports and resources are needed to help other communities successfully implement palliative approaches to care for people experiencing homelessness or vulnerable housing. Throughout the design collaborative, we will also seek input from the initial 10 communities on what supports will be most helpful as we prepare for the second part of the program, which we are calling the improvement collaborative. Once we approach the end of the design collaborative phase, together we will take the learnings and information we have gathered over the past 18 months to co-develop equity-based tools and resources to support the next cohort of 10 communities that will be part of the improvement collaborative component of the program. So starting in 2024, this is when we will shift to the improvement collaborative phase of the program. This part of the collaborative will be informed by what we learn from the communities engaged in the design collaborative and bring additional communities organizations together to begin their own implementation journey. The goal of the improvement collaborative is to drive the rapid adoption and spread of innovations identified through the design collaborative to improve equitable access to palliative care and community for people experiencing homelessness or vulnerable housing. Both cohorts, so the design collaborative cohort and the improvement collaborative communities, will have access to all of the collaborative activities, including funding of up to $100,000 per community, a learning series with webinars and workshops, coaching, and peer-to-peer networking. Additionally, throughout the program, we will be asking you what supports you would be helpful for you as you work to design, deliver, and evaluate programming that improves equitable access to palliative care in your community. In summary, the overall goal of this collaborative, both the design component and the improvement collaborative component, is to support communities implement and evaluate equitable, safe, and quality palliative approaches to care. Learning from the design collaborative will help inform an improvement collaborative that will launch in 2024. The improvement collaborative will continue to support the 10 cohort 1 communities and will provide seed funding to an additional 10 communities, representing a total of 20 communities in all from across Canada focused on improving equitable access to palliative care. So now I'm going to pass over to Raquel to discuss more what the collaborative approach can offer.
Thanks, Tanya. So Tanya gave a good outline of the approach to this funding, but wanted to say some of the benefits of joining this initiative is, number one, the funding opportunity. Again, to reiterate, you'll have the opportunity to get to up to $100,000 over either the 2-year term that you apply for, either the design or the implementation collaborative. This funding can be used for many things. It can be used for things such as program management, for community engagement, or for evaluation support. The call for application also outlines some additional things that the funding can be used for. Another benefit of joining this is you'll have opportunity to have interactive dynamic learning and implementation support opportunities, which includes the webinars, the peer-to-peer support, the coaching models, different trainings. You'll also have the opportunity to work with us on measurement and evaluation. So we'll work with you in order to identify some key measures that will be feasible to collect and report on in order to actually measure the impact of your initiative. Some additional benefits of joining is that you'll receive implementation and capacity supports at any stage of your palliative care program development. So for example, you could be at the engagement stage where you are engaging with individuals with lived and living experience, engaging with caregivers, providers, and community members and organizations. Or you could be at the stage where you are leveraging existing education to provide palliative care education to people providing or receiving palliative care. Or you could be at the implementation stage where you're implementing a new or expanding an existing palliative care program, or at the point of sustainability within your program. We will have a better idea of the shared priorities once we know I've identified the first 10 cohort teams. And with that, we'll also be applying the coaching model to support the individual priorities that have been raised by these teams. Some additional benefits of joining include having access to capacity building opportunities to create and support meaningful partnerships. As part of this collaborative, you will be part of a pan-Canadian collaborative, which will help you to identify shared learning, some lessons learned, and opportunity to support long-term sustainability and success of your initiative. You'll also have the opportunity to guide and inform the development of resources to support additional communities who would like to improve access to palliative care for those that are vulnerable, are homeless, or vulnerably housed. So who should apply? In order to be eligible for funding, you must be a community or organization, which could include a regional health authority, communities, and organizations that are responsible for the delivery and/or funding of palliative care supports and programs, or the delivery of supports for individuals experiencing homelessness or vulnerable housing. We have also identified here and provided a definition of community. So if you are unsure of whether or not you are eligible to apply, please reach out to our team and we can help you with that. So what are some initiatives that are eligible? Again, wanted to highlight that you can be at any stage of your improvement journey. Again, you could be at the planning stage where you are doing some initial engagement, or you could be at the stage where you are actually implementing an initiative and implementing and delivering programming. Or you could have an established palliative care program and you would like some support in maintaining and sustainability of this initiative. Now I want to turn it over to Lindsay to walk us through the application process.
Thanks, Raquel. So let's talk a bit more about that application form. And for clarity, there's two documents that I'll be referencing in this section. The first is the call for applications itself. That gives you more detail about the opportunity and the questions that we ask in the application. If you've been on our website, it is the first kind of document that you can click on. The next document is the application form itself, and the application form is what you're going to submit, but both documents are going to be relevant to your application, and you will need to review both in order to complete that application form. So once you've determined that your community or organization is eligible, the next step is really to start that application form. And right away, you're going to notice that the application requires a lead organization to be identified. So if you're applying as a single organization, you are in fact the lead. But if you're applying as a community, and that means you're multiple organizations working together, you will need to identify your lead. So the lead organization will commit to signing a collaborative agreement outlining requirements around funding, the distribution of funds, things like data sharing, intellectual property, audits, records, and confidentiality. The lead organization also will need to devote their time, provide leadership support, identify and support providers, staff, clients, patients, community partners to participate in the activities. And they're going to be the ones responsible for submitting deliverables that we outline in the application form. So if you're going through this and you're not sure who would be the most appropriate lead if you're working as a community, we encourage you to reach out and we can help you walk through some of the considerations. And you'll find some of that in the call for applications document as well. So once you've identified that lead organization, you might be wondering, so what's the role of other organizations if in fact you're applying in as a community? And in this case, other organizations are going to be considered participants. We have included a number of extra pages in the application to include participants. If you need more space to do that, please just attach additional forms reflecting the same categories that we've asked. There is not a limit to the number of participants, so really up to you and what makes most sense in your community. And those participants will be participating in the activities. They will be working to submit those deliverables that are outlined in the application. And we've got quite a fulsome list of some of the details on the roles of those participants in the call for application document. So I won't go over these here, but we're happy to if there's any question. So once you've identified that lead organization and the partnering organization that will participate in the collaborative, it's time for you to clarify the members of your team. And we're going to call this your improvement team. And you'll see there's a section on the application itself to speak to your improvement team. So you're going to list the members of your improvement team, including the name, the role, their organization. And we really want you to make sure that the team includes people with lived and living experience, staff and with diverse skills, professional backgrounds, cultures, lived experiences, and perspectives. This group will help you ensure key perspectives are considered and will help ensure improvements to palliative approaches to care are ready to be implemented and sustained. We encourage you to also think of evaluation and project management support that you may want to include on this project team, recognizing that folks have a lot on their plate in addition to this work. And as Raquel mentioned, you might want to think of how you can use the funding to support with these roles. In an effort to advance reconciliation and address health inequities, considerations of First Nations, Inuit and Métis priorities is embedded across the work of both HEC and the partnership. Equitable access to culturally safe palliative care has been identified as a priority for many First Nations, Inuit and Métis communities. And this section is designed to assess your community's readiness to meaningfully engage with First Nations, Inuit and/or Métis, and to ensure their priorities are embedded within your work to improve equity and access to palliative care for people experiencing homelessness or vulnerable housing. We encourage you to do some research, read existing reports about First Nations, Inuit, and/or Métis priorities related to palliative care before engaging with communities, so that you can either validate existing data with local communities or identify gaps in knowledge and seek guidance from those local communities. We suggest discussing expectations from those that you're engaging with up front, how this will be communicated. so that people can decide how to contribute or not. We will be looking to see how you'll integrate the guidance you receive and/or implement what you hear, and other things such as how you'll create reciprocity in the relationships that you have developed or will develop with individuals and/or organizations. Next, you'll see there's a project management section. We ask you to describe your project and scope. So really help us understand what is it that you're trying to do and how. We're looking to see what the goals you hope to achieve by 2026, and that's the planned end of the 4-year collaborative, and what the key work of your improvement team will be. We've suggested that you outline 2 to 5 key inputs or deliverables from the project that are most meaningful and will be used to demonstrate success in improving equity and access to palliative approaches to care. You will also see the project delivery plans, and that's a tool to identify key deliverables and milestones within each activity listed in the project scope to ultimately achieve those project goals. So we recognize this plan may be quite high level, depending where you are in that planning process. And as Raquel mentioned earlier, you might be in the engagement phase, planning, in implementation, or you might be looking to evaluate and sustain. So if you haven't started the engagement work, your project plan will look very different than from someone who is implementing or has spent several years in this work and is looking to expand it. And that's okay, but we do want your plan to match where your project is. In the collaborative support section, it is fairly straightforward. We want to understand more about your priorities, and going back to the discussion earlier around what supports you need, we're looking to understand this so that we can begin to plan for supports that will be helpful as we embark on this journey together. We're asking you to submit a proposed budget, and groups have access to up to 100,000 over 4 years. And the maximum amount is listed for each year at the top of this section. We also include eligible and ineligible expenses in the call for applications document. But if you're unsure if your request fits specifically within those parameters, again, that's a great question to reach out to our team with, and we can help ensure that you submit a budget for things that are in fact eligible. So we've covered a lot of ground in the last half hour, and I'm going to jump to the chat box and see what questions have come in. So please take a moment to ask any questions if you haven't yet had a chance to do so. And I'm looking to my other screen and the team. Emily, I don't know if we've had any questions come in the chat box. Oh, great. I see a question here, so I'll start with that. And the tech team in the background can let me know if I'm missing anything. So who is on the decision-making panel on choosing the 10 communities? Tanya, can I perhaps hand that over to you to give some context?
Sure. So how we assess the applications that come in and able to make informed decisions about who the 10 communities will be is via what we call a merit review panel. And therefore, these individuals are identified given their roles in the health sector or social sector based on their experience in this space. And they bring an objective view to the evaluation process. And so typically how we organize the merit review process is that 3 individuals review each application independently, and then we all come together during a review session and then discuss the applications. And then based on the criteria that match what you have submitted as part of your application process, then we make decisions on who those 10 or which 10 communities will be eligible to embark into the program in the phase 1, which is the design collaborative phase. And so we have a scoring matrix that is in line with the application form and objective reviewers and a consensus discussion that happens around the whole application process.
Thanks, Tanya. And if that question hasn't been adequately answered or you have more questions, feel free to add some follow-up in the chat box. The next question that came in is how many projects will be supported? So in this cohort, we will be looking at 10 specific projects, so 10 community projects that are coming forward. We do plan to support another 10 projects or communities as part of cohort 2 in 2014. And Wayne, I think that comes to your question then, which is, can we apply later than October 3rd? And unfortunately not. However, we will be doing a call for applications for the 2024 cohort, so cohort 2. So it is possible that if the timing of this call for applications doesn't work best for your team, that you could resubmit at that time. And Wayne, if there's anything that our team can help you for those that are in the planning stages, because you are eligible to enter, especially given the 4-year time frame of the collaborative, then let us know and we can help chat more through that. And I see the next question is, when in 2024 do you anticipate the applications for the second cohort? We haven't finalized those dates, but we do expect to welcome the second cohort in 2024. So that could in fact mean the call goes out in 2023. It really is too soon, unfortunately, to know, but the kind of admission date of those teams would be within 2024. A great way to keep updated on that is to sign up for the HEC newsletter, as all new calls for applications would be shared through that process as well. Tanya, anything more to add to that question?
No, I mean, it's a great question, and we endeavor always to include people with lived experience on our panels when looking at applications into programs, as well as into program design and evaluation. And so that is a very important question. And we do we will have someone with lived experience as part of our merit review panel. And as part of that whole process, we also have an onboarding system to make sure that everyone is familiar with the process and has an opportunity to engage with the criteria and the discussion prior to the review period.
Thanks, Tanya. I think that answers the question that came in terms of how we engage folks with lived and living experience of homelessness on the merit review panel, and also reinforcing that's really important for our work that we have an advisory team that will be supporting these cohorts as well. So it's not just HEC and the partnership and isolation. We look to engage more broadly and partner, including with what we would internally say patient partners, that lived and living experience is accurate. Kelly, I see your question is 100 per project a total amount, i.e. potentially 25 a year. So yes, we will include, and it is on the side of my desk here, what amount per year. So we do actually have a maximum amount per, in this case, we consider it per fiscal year, which this year is up to 25,000. Next year, I believe, is 30,000. The year after, 35, and the final year up to 10. So it is divided in that way. Allison, I see your question. 10 communities across Canada. Will this be one per province territory? Tanya, over to you.
I mean, that's an excellent reflection. I think we always endeavor with all of our programs to have representation from all the provinces and territories across the country in all of our programming to ensure that we have a diversity of communities participating, whether they be rural or urban, and also across all the different provinces and territories in Canada. And so that is part of the decision-making process as well. But we do also assess based on merit of the application and readiness to engage in the work. Therefore, it is one of the factors that influences the decision, but it's not the only one. But it does get taken into consideration when we do the evaluation process for the applications that come in.
Thanks, Tanya. And I think if I haven't missed any questions, the next one was, if we apply for the 2024 cohort, is it still 4 years or it's down to 2? And you're correct, it's down to 2 years then for that team to, those cohorts of teams to participate. So although the funding amount is still intended to be similar, it is in fact less years participating in the collaborative. And talking about the difference between the two collaboratives, design and improvement cohorts, thank you for reflecting that back. We've been trying to figure out how to best communicate that. So I'm glad to see there's some recognition of the difference between the two cohorts. Can teams still be in the planning stage if they are applying for the improvement collaborative? That is a great question, and I don't know that we have the answer for that yet. I'm looking at Tanya and Raquel across my screens of without having identified that eligibility criteria yet. I'm not fully sure, but Tanya, what are your thoughts?
Yeah, it's a good question. Teams still in the planning stage and improvement collaborative. I think the idea was that the design collaborative was that opportunity to build together and learn from each other through the different phases. And when we got to the improvement collaborative stage, it was more around the implementation journey. However, I think that there's opportunity to reflect on that as we look at the applications that come in the communities who are applying into the program and make that decision as part of our merit review process. Also, just adding that we are not, as Lindsay mentioned, our two organizations making these decisions on our own. We will have access to a steering committee, which we can also engage in conversations around what is the most appropriate stage per collaborative to make sure that we're engaging and including as many communities as we possibly can. I don't know, Raquel, it'd also be interesting to hear your perspective as well on this question.
Yeah, I agree. I think a lot's going to have to depend on what comes into the first cohort and what are the gaps that we have identified within the first cohort. And if the second, the improvement collaborative will address some of those gaps and they're still in that planning stage, and we may have to kind of think about that, right? So I think it depends highly on what we get in that first cohort of 10 teams.
Thank you both. And as learning organizations, we also want to be listening really intently over these coming 18 months of what we're hearing from communities that is needed to best support. The next question is, do we get feedback if we are not successful? And yes, our team will share feedback with you from the merit review panel so that, for instance, in this case, as you imply, if you were applying for a future application, you would be able to incorporate that. Feedback is provided to both successful and unsuccessful teams because it also helps consider where there may be gaps or opportunities to further improve the work. I see the next question is, what would you say is an organization that has good merit on their readiness to complete the work? That's a big question. Tanya or Raquel, did you want to start us off?
Do you want to start on this one, Raquel, and I can follow up?
So repeat the question again. Oh, what would you say as an organization has good merit on their readiness? I would say if they've already done a lot of the planning and the engagement. So I think the engagement, the community engagement is key in order to be able to, if you're at the stage of, you're thinking that you're at the readiness stage of implementation, that's probably a good sign that you're ready. Also, if you are pre-established, so I know there's some people on this call that are pre-established programs, and you're probably very ready, but you may be at the point of looking at sustainability, right? So that may be something that identifies that you're ready kind of to move forward on that next stage for support. But I don't know if I interpreted that question properly. So Tanya, over to you.
Yes, and just building on Raquel's comments, I would also say that there's clear organizational community commitment to advancing this work within their community. And I think that touches on a lot of the components that Raquel had already mentioned about, the engagement, being engaged, the engagement process has started. There's potential partners that have been identified. There's an understanding of community needs in order to move the work forward. And I think also strong leadership support from the organization, the communities, and the partners to collectively achieve the program goals and ensuring equitable access to palliative care over the course of the program. I think that goes a long way in ensuring that an organization and their partners are set up for success because they have that support and that willingness and space to do this work and move it forward over the 4-year program. Or 2 years, depending on when you come in. Just adding a bit of complexity with our multi-part program collaborative.
Absolutely. I hope that answer is helpful. And I think as you've both articulated, there's really a complex interplay between all of these factors for readiness. And part of having diverse perspectives on the merit review panel is it also gives us different ways of seeing readiness and engagement, each coming from our own viewpoints. Are we able, I love these questions because they really get us thinking, are we able to apply for funding as part of both cohorts for 2 different projects? Great question that hasn't come up yet, I don't think.
I think we would need to reflect on that, just jumping in, Lindsay, because part of our organizational priority is to support as many communities as possible and diverse communities, and understanding that multiple communities and partner organizations have multiple projects that would align with both phases of the programming. I think that we would need to consider the applications and ensuring that we've given equal chance to all communities across the country to participate. But I think that is a very good question that we could bring forward as well to our steering committee and to get some clearer guidance on that. But that would be my initial response, is that first look across the country to make sure that we're supporting as many individual communities as possible as a priority.
Thank you. See, the next question is, will you be sharing identified gaps when accepting applications in the 2nd cohort? And this has been our preliminary thinking, is that this application process will give us a lot of feedback of what worked, what didn't, even better if for the next time, and how we can best support organizations and communities in being prepared for the next funding call. So that is the hope, certainly, is that the learnings from this time and the feedback. If you have feedback on your experience through the process, we are always happy to hear that. So please don't hesitate to reach out to our team as well. The next question is, would this funding support research into improved access for populations, or is it limited to direct program delivery? And this is a great question. It is focused on directly impacting client or patient care. So it is expected that a program would move to implementation and direct client or patient reach through the 4 years. Do the criteria Raquel just outlined also apply for applications in the planning stage? So Raquel, I think that's back to the readiness question.
Mm-hmm. Yeah, and I think Tanya might have addressed that after, because she jumped in after. So I think Tanya had identified some additional criteria about community engagement, commitment from the community, building those relationships. And I think that's all important for the planning stage. So I would say yes, if it was those criteria that you're asking about. And Tanya, I don't know if you want to add anything to that.
Yeah, I was just thinking also, I mean, understanding that everyone is at a bit of a different place in terms of this work and their readiness to engage in the program. And so from a planning stage perspective, also, I think it'd be important to demonstrate that there's been some thoughtfulness around, identifying the who or the what would be next as you think of moving the work forward, understanding that some people may already have established partners and are on their way within an implementation of different practices to improve equitable access to palliative care, and others are just a little bit further upstream. And so demonstrating that there's a plan in place, or that there's been thought and consideration for the who and the what you would do next, I think would also be important to demonstrate that there is commitment to this work and moving it forward, and that there's the start of a plan.
Thanks, Tanya. Great points around the importance of partnership and ensuring that folks around the table, kind of both those with lived and living experience, those serving underserved populations, and those who are able to provide palliative approaches to care. I am looking at the production team to see if we've missed any questions. But thank you, everyone. Those were excellent questions and lots for us to think about and reflect on as well. Just looking, have we missed anything, wonderful tech team? Doesn't look like we have missed any questions, but again, if your question hasn't been answered or it comes up while you're doing the application, reach out to us along the way. So we'll bring back up the slides. We'll share a few more details in terms of next steps, and then we will conclude. So eligible teams, programs, organizations, communities are invited to apply to the Improving Equity and Access to Palliative Care Collaborative by completing the application form. It does need to come to us through email. That needs to be submitted no later than October 3rd at 12 p.m. Eastern in either English or French. And then HEC will notify you of the outcome of your application by the end of November. So thank you everyone for your participation today. We hope that you found this session informative. A recording from today will be shared out later this week via email with all participants and posted on our website. For more information around the collaborative, if you have questions, please contact our team via email. And again, one last time, we're here to support you. So again, if there's anything we can do, please do let us know. We would ask that you take a brief moment to answer the quick poll that we're going to post on the screen here. There we go. And really the question is, following the informational webinar today, do you plan to apply? Interested in applying? Not sure if you'll apply, or not interested in applying or will not apply? So thank you again, everyone, for joining us today. Really appreciate you taking time for this conversation and for this really important work. Wishing you all the best. Until next time, take care.